Alrighty, it looks like we are live again this Sunday morning. It is January 11th, 2026. Some people believe that this is a special day because of the 111 correlation. I think it's a special day because I'm alive. My name is Keva Mack. I'm a licensed massage therapist and a board certified holistic health practitioner. And beginning at the beginning of the year, I started coming on doing lives to present my um, views, opinions, information to help you to navigate this interesting terrain of mind body wellness, of natural wellness, of self care. And today is no different. Today, I want to talk to you about not only some of the things that happened in my office today, but some of the things that are questions from clients that I have. And I thought that, hey, why not share that with the public? So today at my office, I had a client, or this week at my office, I had a client to come in and she had a reversed shoulder replacement. I did not know what reverse shoulder replacement was, but I did know how to care for a shoulder replacement client. And she came recommended by another massage therapist that I have known for years. But she came in and she in my office, in my practice, clients register on my website. They provide their information, they provide the reason why they're coming in. And I was familiar with her situation because I had actually seen her as a client when I was working for another or at another facility. But she came in, and before she came in, I was familiar with her situation because I had all of the information pertaining to her concern before she arrived. The reason why I do that is because I want to be able to do research about the concern before the client actually comes in, because I focus on, in my massage therapy practice, post op care, which is what she was coming in for. She had had a reverse shoulder replacement. And I also focus on pain management as a massage therapist. So she came in and we were discussing her situation. She was currently in physical therapy, and she said that the physical therapist was working with her, but because of the muscle stiffness, they were only able to get to a certain point of growth in her care. And so a physical therapy assistant came in and began to massage her arm, because she had told me, and I'm betting she probably told them, that her arm was so painful, even with the pain medication. And she told me that she didn't like taking it. But she said even with the pain medication, she was still having trouble sleeping because of the pain. And so she said that the physical therapy assistant massaged her arm and it helped a lot. And her physical therapist told her that it would be a good idea to seek out the assistance of a massage therapist. So she contacted one massage therapist, and that massage therapist's office was undergoing renovation or some constructural um, changes. And so that massage therapist referred her to me. And so we were discussing her arm, the surgery, what her physical therapist had said. And with orthopedic massage therapy, I don't start to work on them until 6 to 8 weeks after the surgery. And she was 8 weeks post surgery. So she was a good candidate for post operative orthopedic massage. And so she came in, we talked, and I told her what I thought the best course of action was, and she gave me information, of course, about what her doctor and her physical therapist had said. And so we got her on the table. She was concerned about laying on her stomach because of the surgery it was on her left shoulder, um, running perpendicular. this way. And so she was afraid uh, to lie on her shoulder. And I told her that because she was afraid to lie on her shoulder, it probably was not a good idea for her to lie on her shoulder. And so we did the entire massage face up, which is important because she was getting manual lymphatic drainage, and the majority of the lymph nodes in the body are located on the anterior region, on the face up. So I was able to do the massage that way. And so she even fell asleep. She was snoring. She was relaxed. So it was a good thing. And I was able to do some deeper tissue or deep tissue massage. And we'll talk about the difference between deep tissue and deep pressure, because that's another misnomer that I hear a lot in our industry in massage therapy. So maybe not this session, maybe not this episode, maybe another episode, but we'll talk about the difference between deep tissue and deep pressure. But so I worked on her, and during the session, she told me that she had gone to, because she had this was her left shoulder we were working in with, but she had told me that she had had surgery on her right shoulder as well. And she said during the recovery process for that shoulder, she had gone to a medical massage therapist in a nearby city. And she told me how much that medical massage therapist helped her in recovering after her surgery. And so that made me think that I needed to help people to understand how to navigate the landscape, or how to navigate in finding a massage therapist that worked with people after surgery and what they needed to look for in that person. So the first thing that you need to determine if you're working with a therapist who works with people after surgery is, number one, are they licensed? That's the first thing we need to be concerned about, because all of these different types of massages or massage therapy deals with different types of issues. And in massage therapy, a lot of therapists are taught techniques that focus on relaxation. And when you are working with or looking to work with a massage therapist who is skilled at working with post-surgical clients, that therapist needs to be trained beyond relaxation therapy. At my school, we were focused on clinical massage therapy. We are licensed massage therapists, and our education included relaxation massage, but the particular school at the time, because I'm not sure if that's still the case, but at the time they focused on clinical massage therapy. And clinical massage therapy is evidence-based massage therapy focused on a particular medical or health related concern. So a person who was seeking out assistance after plastic surgery, cosmetic surgery, orthopedic surgery, that person would be looking for a massage therapist that focused on clinical techniques. So that means that they're focusing on issues that, and I say in jest sometimes, you would go to a clinic for. So if you would go to a clinic for neck pain, shoulder pain, back pain, sinus issues, rotator cuff issues, those are the kinds of issues that a clinical massage therapist has been trained to work with. There is some confusion in the industry about the difference between clinical massage therapy and medical massage therapy. These statements that I'm about to make are based in logic, but they are my opinions. So, based on new information that I receive, Um, it just told me that my camera was obstructed. Based on new information that I receive, um, I'll change my statements. But right now, in my mind and in my experience, medical massage therapy is massage therapy that is ordered by a medical practitioner or a medical doctor. So, in my experience, I have worked with organizations that secured clients or patients, and I have worked with those patients to to fulfill a prescription that was written by a doctor. So, in the cases that I have worked with, clients have had concerns like cerebral palsy. They have had Parkinson's disease, or I guess it's called Parkinson's. I'm not sure anymore. Things change. But at the time, Parkinson's, cerebral palsy, things like that. And the doctor will write out an annual prescription, and they will ask someone like me who is trained clinically to provide care. Um, and I keep clinical notes, and those notes are provided to the doctor. In many cases, the prescription is filled by me, and the insurance company pays for the care. That's, in my mind, how medical massage therapy works. It is ordered by a medical professional, a doctor, a nurse practitioner, and they actually write out a prescription telling you what muscles or the frequency, how long the massage needs to be. It's nothing left to guesstimation. It's very specific. Um, if a doctor is not requesting, or a medical professional, nurse practitioner or doctor, is not requesting that massage therapy, it's not medical. That's my professional opinion. It's not medical. If you are coming into a massage therapist and you've had surgery and your doctor has not sent me a prescription for massage therapy, that is a clinical massage therapy session. It is not medical, because I am not a medical professional. I am a healthcare professional. I am not a medical professional. I don't have a medical license. I have a massage therapy license. I'm a healthcare professional. So I just wanted to clear that up, because I see a lot of people advertising, a lot of massage therapists advertising that they are a medical massage therapist. No, you are a licensed massage therapist, and you provide medical massage therapy if the doctor sends you a prescription. If the doctor does not send you a prescription, you are providing clinical massage therapy, because you're not working under the direction of a doctor. You are working based on your clinical knowledge of massage therapy. I'm saying this because it is confusing to the public. They come to me asking me, do I provide medical massage therapy? And I said, yes, just have your doctor to email me or to fax me the prescription. And they looking at me like, what? They're looking at me like, what? Yes, just have your doctor to fax over or to email me the prescription. Here's my email address, here's my fax number. And they were like, oh, no, I didn't mean that. No. Okay, so if you're self-referring, then this is a clinical massage therapy session. This is not medical, because in many cases, if it's medical, your doctor is going to, your insurance is going to pay for that. So I just wanted to clear that up. Now, every time the doctor sends over a prescription or a note, a letter of medical necessity, any of that, the insurance company doesn't always pay that. But if I work based on the doctor's prescription or the doctor's information, then that's medical massage therapy. But many times, because of if it's that, then the insurance will pay for it. In the state of Texas, it's really different because massage therapists do not have the ability to charge your insurance. Um, so there are very few times that people who are saying that they are receiving medical massage therapy are actually receiving medical massage therapy, because doctors don't generally send over notes to us. Um, they just don't. They just don't. I do get notes from doctors, but because Texas does not allow us to bill the insurance, clients aren't able to file it on their insurance. But many times, what they will do is get a receipt from me, and then they will get reimbursed if that's available on their insurance. But just wanted to clear that up. Medical massage therapy versus clinical massage therapy. If it's medical massage therapy, there is a doctor involved. If there is no doctor involved, that's clinical massage therapy. Massage therapists that provide clinical massage therapy or medical massage therapy must have a license in massage. And it's not a medical massage therapy license. It's just a license in massage therapy. And what that therapist is providing is clinical massage therapy or medical massage therapy. And like I said before, what the difference is the doctor. The medical doctor or the nurse practitioner makes the difference. All righty, so I'm glad we got that cleared up. Another thing I wanted to talk about today is yoga. Wanted to talk about yoga today. Why? Because there is a rumbling on social media that SZA, y'all know who this is. Y'all know more than I do. That SZA out in these streets saying that yoga is demon worship. Now listen, I got this off Facebook, so I don't know if this is what the woman said or anything. I just know that it's on Facebook, and I've also seen it on Instagram. I did not hear these words come out of this woman's mouth, so I don't know if that's what she said or not. But I know that I saw a post online that says that singer SZA recently commented under a social media video from a woman who used to be deeply involved in yoga, who was exposing that it opened her up to demon attack, and that God revealed to her that it is unknowingly the practice of demon worship. Okay, there are so many things I want to say about this. Okay, so is yoga demon worship? I would say no. I would say no. I would say that if you feel like you should not be practicing yoga, that you are not supposed to be practicing yoga. I do believe that very conservative spiritual traditions believe everything or a lot of things are things that they should not practice. And because of that training, a lot of things open them up to negative experiences because they are so limited in their experiences. But those of us who practice don't practice traditions that are so restrictive, don't see this as a concern. I do not believe that yoga is demonic. I have practiced yoga since a long time. We're not going to get into dates. We're not going to get into dates. But I have practiced yoga for a long time, and I do not believe that it is demonic. I think that lack of experience, I think that lack of also, it depends on who is exposing you to the teachings, who is exposing you to yoga. Because years ago when I was teaching at a spa in Frisco, Texas, the uh, management there made it very clear to me that we were teaching fitness yoga. And fitness, there are different types of yoga based on what you want to focus on. In more spiritual religion, I wouldn't even say religion. Some religions integrate yoga into their teachings because it's a spiritual practice. It is not a religion. And I think that people are not aware of, or they could be more aware of the traditions that they are involved in. Um, when you go to a yoga class at a local gym, they are not going to be praying, they're not going to be chanting, they're not going to be doing any of those things. But those things are part of religions, and sometimes they integrate yoga into those traditions. But that doesn't inherently make yoga demonic. I also think that there is a level of disrespect when you say traditions like that are demonic without doing your due diligence and doing research. Now, you can say the type of yoga that you practiced may have been demonic. You just can't make a blanket statement like that, because at that point you're disrespecting other people's traditions. You're disrespecting their belief systems, their traditions, and it seems to me that one tradition in particular is very free with calling other people's spiritual traditions demonic. And I don't even have to tell you what tradition that is. There's always this one tradition that is always calling everybody else's practices, spiritual practices, demonic. And I don't even know why I'm talking about this, because everybody knows what tradition it is. If you shouldn't practice it, you should just say, my spiritual practice, my spiritual tradition says that I should not practice yoga. Stop saying that yoga is demonic. Yoga is not demonic. There are people out here who are saying that yoga as a practice has transformed their mental clarity, their physical ability. It has transformed their ability to stay calm in stressful situations. And now you're saying that yoga is demonic based on what? Based on what? That's like saying that because the Grimm version of the fairy tales is sad, or y'all know the original Grimm fairy tales were not like what we are experiencing in Little Red Riding Hood and stories like that. They were rough. But that doesn't mean that those stories are evil. It means that version of the story is a little stressful. It's a little challenging to read. But that doesn't mean it's evil. To say yoga is evil means that you're saying that all of yoga is evil. That's like saying all people of this religion are evil, or all people who have locks or have their hair like mine are evil. I think that's a broad state. It's too broad. And so that's the problem I have with it. People can say whatever they choose to, but when you make statements like that, not only are they incorrect, but they show a level of ignorance is what they show. And I know that this person, SZA, is an artist, but you need to be mindful of who you're following and where you're getting your information from, because she is not an expert in yoga. She's just not. And so, but the majority of people who read this information about her are not going to consider that. They're not going to consider she's not an expert in yoga. They're just going to say, okay, SZA says yoga is evil. So yoga is evil. It's demonic. And it's not. It's saving people's lives. It's saving marriages because it's helping people to stay calm, to relax. It's helping them to reverse negative effects on their health and wellness. And this chick talking about it's evil. Girl, really? So those are just some comments that I wanted to make about yoga. Yoga is not evil. There may be some aspects of yoga that you will not integrate into your yoga practice, and that's fine. All you have to do is find another school of yoga or go to the gym and practice yoga, because they're not going to integrate anything into that practice at your local gym that's going to turn off the average person. It's going to be very basic. You might do some deep breathing exercises. You're going to do some yoga poses. You might do some guided meditation, and just take it from there. And stop calling everything evil just because you don't agree with it or your spiritual tradition doesn't agree with it. If it's something that you are not aligned with, just say that. But just saying that yoga is evil is ignorant and it's misleading. And in order to educate yourself, you have to stop looking to people in social media and stars and all celebrities for your information. They are not experts in yoga. They just are not. So that's about all I have to say about that. So yeah. So that's all I have prepared for today. So I am going to close this live out. You can find me on social media, Facebook, Instagram, even LinkedIn, and right here on TikTok at Keva Mac at KevaMac.com. I'm also available on YouTube at Keva Mac LMT. I am providing massage therapy in my office in Grand Prairie, Texas, as well as therapeutic bodywork. And to book an appointment there, as well as online, because I do online services in somatic therapy. But you can just contact me at KevaMac.com. I hope that you are having or creating and manifesting an amazing week, and I will see you next Sunday. Y'all take care. Bye-bye.